I have 4 children. Since I came here, we use water from the water supply, and sometimes when dry season, the water gets dry. So we have to carry our children and the cargoes down to the creek down there, but the mountain is too steep, so it gives us burden to do all those things. The gardens that we grow, it's almost 6 months, but because of the sun, the garden that we plant, it never grow, but it dries and then we replant again. Until now, 6 months, the garden, it's not grown yet, it's just like that. Sometimes we get help from the college, and we survive from that food. If not, sometimes we don't get food, we sleep like that. We do not eat, we drink water and we sleep.
Most people in Papua New Guinea live in rural areas. Unlike many other countries, rural populations have increased more rapidly than urban populations. This has put pressure on natural water supplies. Unsatisfactory water systems, inadequate supplies, and unsafe water sources all cause high rates of waterborne diseases.
Well, water, it's got many needs. We know that you cannot live without water. 1, 2, and in the sense of understanding the body and knowing the body, you know that 75 or 80% or so is made up of water along the body cells. We are looking at a young girl who is supposed to be enjoying her life. Instead, spend so many hours going down the drain to collect water. In the process, they may fall, sleep, break their hands or so. That's another complication or problem. Or they fetch water, come up, and over the years, how many times they do that? And they waste a lot of time. And that's just one among the many things we can foresee from the difficulty of having access to clean, safe water. Giving relief to someone's life so that they can do other things, like gardening, for example, or going to school, for example, or doing their studies, even the children. Because the girls are supposed to do studies. Instead, they spend several hours, walk, fetch water, and back to the house.
Australians know only too well the difficulties that water shortages can cause. Although water seems abundant in PNG, many villages often experience water shortages, and where there is a supply, it probably won't be drinkable. There isn't a simple solution to this. While one village might need a well, another might need rainwater tanks. In other areas, the issue is keeping the water source free from contamination by human and animal waste.
Waterborne diseases basically, and in relation to water and waterborne diseases, there are some diseases that can be passed through water, with water or no water. So when there is no water, we're looking for things like diarrhea to happen because somebody goes to the toilet, they don't get to wash their hands. Or diseases like cholera, for example, or typhoid. Fever, for example, can be passed on because somebody is not washing their hands or failing to cover or wash the food properly or things like that.
This center serves a population of more than 2,000. Back in 2009, early January, we had a long wet season. up till April this year, 2010. Since then, we had a long dry spell, all of May, June, July, August, September, October. I was away in Hagen, but when I came back, I heard from people saying that the rain started on the 7th of October this year, and downpour was big. And it affected all food gardens, from the leaves down to the stumps, in which the sun hits the soil, and then the food rotten into the earth. And some food gardens, the people are unable to get food from the garden. Most, I should say. At the moment, I don't think people are having food at this time. I think they're living on cassava, mainly supplying the whole population in this area. This is the room for mothers to have their babies here. And then I also asked the carpenter to put a sink, so we have the sink here. But unfortunately, we try to connect the water from the supply to this, but at the moment, we are not having any water coming to this tap, which the sinks already have in place. The solution, we need to have a good dam put in place with fast-flowing water, so that it can run through the pipes, and then the water must fill up all the tap stands. And then the one that we are having, this has been going on for some years, the water problem here.
What we normally do is within the Anglican Health Services, we have a water systems personnel. Currently the position is vacant, but when we have somebody, normally people apply for water projects, they request, and we screen the application, and we help them by putting proposals to whatever partner that we are partnering in delivering water.
The Anglican Health Service in Papua New Guinea has done a lot to provide water to the people there, especially to mothers and children living in rural areas. One such project is the water supply at St Margaret's Hospital.
Yeah, this is a Southern Cross tank, 9,000 liters. And this is the intake from the pipe, from the pump, dam to the pump to the storage tank, which stores water for the staff and health facilities in St. Margaret's Health Center, Orbe. I believe this system has solved the problem of this health center having on and off water. At times of drought, they hardly have water, and the staff and the patient or the guardians have to walk down to the river down there where the dam is to get their water, do their dishes, and then carry water up to their houses for cooking. And I feel more happier that this new Oasis pump, ram pump installed, solves the problem today.
The challenge for St Margaret's will be keeping the water source clean, an ongoing concern for the Anglican Health Service, but one they welcome.
I believe water is the main source of life to people, and maybe every living thing needs water, and water is needed at all times of our life. And I like working with water projects because I make a lot of water projects happen and being funded by the donors. I believe there is a lot of water in Papua New Guinea, but some of this water are I have distance for people to go and get. So in order to get water into the doorsteps, we need water system to be in place.